So first off, Keely, there are many different alternative payment models out there, correct?
Yes, absolutely.
Okay, it seems a little confusing, but I believe there is a provision of the Value Act that will deal with the overlap problem. Can you describe that for us?
Yeah, you're exactly right. And there's a provision in which the Department of Health and Human Services would be required to review how how all the different programs are overlapping, and report back to Congress what what the findings are, and would require CMS to address this overlap and what they're calling a transparent matter, and would also remove what a current statutory restriction to allow CMS to distribute savings for each program when programs overlap. And so, I think how they'll actually address the overlap will be determined based on what they find through their analysis. And I would hope and expect that in CMS doing this would gather stakeholder input and feedback from actual participants of these models about what makes the most sense to address this overlap.
Okay, great. Well, thank you, Keely. I've definitely learned a lot in a short amount of time.
What do you think the broader implications are here? You referenced that maybe COVID has revealed that value-based payment is a good model when we possibly will face other massive disruptions of healthcare, and that sort of reveals the weakness of fee for service for providers. Does the Value in Healthcare Act sort of relate to this sort of new appreciation of maybe of value-based care and how it can get providers through these disruptions?
Well, I think it does by creating extending the financial incentives for participating in advanced APMs. A 5% bonus on all of your Medicare fee-for-service revenue is significant, and by extending that for an additional 6 years, that's a real financial incentive, and then also making that financial incentive more achievable by lowering the QP thresholds, the qualifying APM thresholds, in an ongoing way. That makes participating in these APMs more attractive. So I would say that aligns with supporting this movement to value-based care and a movement away from fee-for-service. I would say those are very much aligned, and they've also, as you mentioned earlier, made the shared savings thresholds more attractive for participants of the program, and then to the extent they're able to improve the overlapping policies and the way they pay out shared savings for overlapping models, that should also encourage participation in these models in an ongoing way.
This is bipartisan, but do you expect any real action on this year?
I do. There's a lot of support for this, and we are expecting this was introduced to the House. We are expecting the Senate version to be introduced. And as we go into an election year, it would go into an election. I do think there's strong support, both in the House and the Senate for this. There's a lot of support for, but there's a lot of advocacy to support providers during this, to help providers after this unprecedented time. The provider community has been hit really hard by this national emergency, and there's a strong need and desire to help providers continue to provide services after this national emergency. So I do think there's strong support for modifying the APM thresholds and for making participation in these models more attractive.